later. I know. When I
was
see
dozing
Tacey on her phone, just wink at me, Scott, and I'll slip in the
She'll never
birthday
know.
announcement. Okay. So, we've got some things. We've got a question or two, obviously, about Damar Hamlin. I was supposed to be on Anthony and then on Gino Bisconti's show and a couple other ones, and I just was so busy this week I didn't have an opportunity to talk about it. Well, we can just go ahead and get this out of the way now. I think that's the thing that people
Let's do
are
it.
really
Yep.
interested in. Let's see.
Hey, Dr. Steve, it's Matt Charleston.
Hey,
I'm
Matt.
calling to ask you about Damar Hamlin,
Yeah.
the Buffalo Bills player who was hit Monday Night Football game. Got up from the hit, stumbled, and then collapsed at cardiac arrest. Heard about this happening in other contact sports like hockey.
Sure.
And wondering if you can talk about that.
Yeah, absolutely. Thanks. We were going to talk about it anyway, but it's always nice to have a phone call.
Like
to
a real
spur it.
question.
Yeah, that's
A real
right.
question.
It's like a real radio show. Yeah. So when I saw it happen, I kind of knew I didn't know anything, but I had a real good idea that what had happened was a thing called Commotio Cordis. And that is so you've seen people, have you seen the movie The Abyss?
No.
Okay, so they do a code blue in the movie The Abyss, completely unrealistic, but a lot of people have seen that. You've got Ed Harris and Mary Elizabeth Mastrantonio over on one side in a submarine a mile down or something ridiculous amount.
Stop, it's enough.
And then they have to get from one submarine to the other.
Yeah.
But they only have one pressure suit.
Ugh.
So she says, just take me over there. I'll die, but then you can resuscitate me on the other side, which is a pretty cool plot point. Of course, she was the smart one. And so he does that, and you see her, halfway through. She's, underwater, and then she dies. When they get her up there, she's dead. But the thing that is apropos to this is he does a thing called a chest thump. Now, in movies, they pound on people's chests and, thong, 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 breathe, damn you, breathe. And then, the people goes, and coughs up water and stuff. But the chest thump itself, so that's fake. But the chest thump itself is real because the heart has the ability to, or one of the characteristics of the heart is that when you poke on it with the right sort of amplitude, you can generate an electrical impulse.
Gotcha.
It's almost like it's almost piezoelectric.
Right.
You have these crystals, and if you thump them, they make an electric current. So this is a different mechanism, but kind of the same thing. So the chest thump is a real thing.
Right.
And if you do it at the right amplitude at exactly the wrong time, what happens is you generate an impulse that cancels out the electrical current in the heart. Now you go, well, how in the hell could it do that? Well, let's talk about that just for a second. The top part of the heart, the atria, and the right atrium of the heart is a little thing called the
Atrioventricular node.
Wait,
Wait, one minute.
Yourself a
Go ahead and give
bill.
me
Look
a
at
bill
you.
right now. I'll take
right.
it. I'll
Okay,
take it.
we'll
Tasty.
take it. Yep,
One
very
is
good.
it, baby.
Very good. You got one bail.
Yes.
And it's basically the pacemaker of the heart. So it will contract, it creates a current that flows from that node to a thing called the sinoatrial node.
Okay.
And no, wait a minute. I'm sorry, the atrioventricular node. We were just talking about the sinoatrial
yeah.
node. So anyway, you've got this sinus node. It fires, and that contracts the top part of the heart. That's the lub, and then it sends this electrical signal to the atrioventricular node, which then has fibers that go all the way down around the bottom of the heart, and it starts to contract from the bottom up.
Right.
But the impulse goes from the top down. Now it's got to repolarize, which means that the current's got to go in the opposite direction to get the heart ready to do this again. So top part is lub, bottom part is dub. You hear the lub dub. Okay, right? So if you hit the heart in such a way that you generate an impulse going in the opposite direction of that impulse that's coming from the atrioventricular node to the ventricle. Okay, so you've got current going in one direction. Now you hit the person just at the right time, just at the wrong place. Right. And now you've got current going in the opposite direction. Those two currents will cancel each other out. And then the heart's just sitting there going, now what the fuck do I do?
Yeah.
It doesn't know what to do.
No. Out of sync completely.
And when that happens, you get a beat called, a rhythm called ventricular fibrillation. And ventricular fibrillation is where the heart is just sort of like, if you've ever seen one, it looks like a bag of worms. It's not contracting in any kind of functional way. And it's just jiggling like jello. And when that happens, now nothing happens. And there's no blood being pumped. And that is a so-called, pulseless cardiac arrest. And, we see this in hockey. See it in baseball.
Yes.
And it's always just a freak
Freak
thing.
accident. Yeah.
If it were really easy to induce, we'd see it all the time in baseball.
Right.
And not so much baseball. In football, we would see it all the time. And in rugby, and in, to a lesser extent, soccer.
Well, and even martial arts, mixed martial arts.
Sure, if you're
people
taking
getting kicked or punched in the chest.
Because all of that would be outlawed if this was.
Right.
And
easily done. Yeah.
One thing I'm concerned about, and this is kind of off topic, is now that we've had, we should look at. Will you look up the incidence of Commotio Cordis on the football field? I just wonder how many other times this has happened.
I can tell you, I've only seen it in baseball. I've seen Little League baseball players occasionally, and which is a terrible thing.
Yeah,
because typically in a Little League setting that happens, and the outcomes are really poor.
Well, and you don't have ambulances standing by.
Yeah, that's my point. Yeah,
and all that stuff. You have to call 911. So. One of the things that we look at when this happens is how quickly was circulation, artificial circulation started. So how quickly do you do CPR? And chest compressions have been shown to push blood around enough that you can keep the brain alive, and because that's your goal. And then you want to get that heart rhythm back to normal as soon as you can. Could you find anything?
I can't spell it right.
Okay. Well, it's okay. Just
I spelled it so wrong that it says.
I don't know what that is.
Yeah.
Okay. It just incidence of cardiac arrest football. Just do that.
Well, that would have been
okay. Yeah, I said it wrong. Sorry.
Yeah.
So, anyway, so you want to to get to the person quickly, which they did with him, and get return of spontaneous circulation as quick as possible, which apparently they did. I think it took a couple of times, and but they did everything right. They put him in the ICU. I'm assuming that they did a hypothermic treatment because patients do better. There's some evidence that when this happens, you can preserve tissue better when the patient's body is cooled down, and we know that people that fall into cold lakes can be resuscitated after 30 minutes of drowning, sometimes 45 if they're a kid. Yeah, Tace, what'd you find?
Okay, so this says this is a study, and it cited an estimate that sudden cardiac death incidents range from 1 to 40,000 to 1 in 80,000 athletes per year.
Okay, so how many athletes are there in the NFL? We should be able to figure this out.
Yeah,
well, just
a couple thousand. Yeah.
Echo, how many football players are there in the NFL?
There are 2,557 NFL active football players.
Okay, so there's, say, 2,000, and you said 1 in 80,000 per year?
Well, it's really stupid what it says because it said 1 in 40,000.
Okay, it's 40
to
80,000.
1 in 80,000. So, I mean, I could have come up with that
Okay.
just
Yeah,
out of
and
my
it's kind of
butt.
a wide range. Isn't
Yeah, a little bit.
Well, that just means that the numbers are so small that they can't give you a real accurate number. So let's say 1 in 60,000 then, right? So there's 2,000. And so what's that? That'd be 1 every 30 years was what we're looking at, right? Is that right? 1 in every 60,000 per year. And there's 2,000 players. Scott? right?
Yeah.
Nobody's looking.
I'm not
They're-
doing
No.
math. I'm
Okay,
not doing
that's
math.
fine.
I don't work
So we would
anymore.
expect a one every 30 to 60 years. That's why it's so infrequent. Yeah, go ahead.
So did he die technically?
Well, I mean, you got to, okay, so that's a great damn question because how do we define death? In the old days, we used to define death as cessation of breathing. When you stop breathing, you were dead. And then what happened was we invented ventilators and mouth-to-mouth and stuff, and we learned that just stopping breathing doesn't mean you're dead. We just need to keep you breathing, so we put you on the ventilator. Then it was if your heart stopped, you're dead. We would declare people dead when their heart stopped. Well, then we developed CPR and the old chest thump. You know, one of the things that could have brought him out of this, had they had nothing, was another chest thump.
Right.
That's the
Try to
interesting
kick it back
thing.
into
Yeah,
rhythm.
yeah, just to kick it back into rhythm. Anyway, so we developed the advanced cardiac life support. When I say we, smarter people than I did, protocol, and people like Brian from BPS Radio / the Radio Freaks who do that every day, resuscitate people every day. The average survival when you have an 18-year-old, say, basketball player who has CPR is right around 17%. But it really that's average, and it has a lot to do, again, with how quickly you get on it. And when you've got a football player that's surrounded with medical personnel, you're in better shape if this happens. Yeah, Tace.
I did find some smaller numbers. It says, according to a 2016 study, and this is from BBC.com,
Okay.
there are approximately 100 to 150 sudden cardiac deaths each year during competitive sports in the U.S. alone.
So that would be what Scott was talking about: Little League, football,
All of
regular
it.
football, everything. Yeah.
Yeah, but I don't think that. I think I would like to see the incidence of the actual cardiac events due to the
thump.
thump. Yeah. Because most of them, or not
Some of them
most
are congenital heart
Most
disease.
of them have congenital heart disease, or they blow a clot or something like that. So it's a little different.
Give yourself a bill.
That's two.
Yeah, I'm up too, baby.
So
big,
anyway,
big difference, though. Big difference
That's
in the
right,
different
that's
types of cardiac events.
and by the way, if you've got kids, don't blow off that physical exam because that's where they
exactly
catch
right.
these things, and this stuff does happen where kids just get passed through, and then they end up in highly competitive high school or college sports and with a congenital heart illness that takes them out of this world. So,
What's the youngest you've ever seen a heart attack or cardiac event in somebody?
oh boy, I don't know, pretty young.
Yeah,
What do you think?
well, I was going to say I saw one when we were in Houston, and he was 16.
Oh my goodness.
Had just a normal MI. Had showed all the normal signs and symptoms, and everybody's like,
Yeah.
well, I mean, we saw him after.
Do they know what
after.
caused it?
It was congenital, yeah, some kind of
was,
resonant defect.
okay.
But,
Because with the diet that kids eat these days, they have found some kids that have atherosclerosis of their hearts at very young ages. I worry a little bit about our kids on that because their diet is not as robust as I
terrible.
would like for it to be. But anyway, so they got to him quickly. Now, when you have someone in the ICU, you don't know if you sedate them and you put them on a hypothermic protocol and you cool them down and then you wait. And one of the things that we use to determine whether someone's going to do well is a thing called the Levy scale. And Levy took 1,000 people that came in with cardiac arrest and looked at lots of different criteria and then developed what we call a multivariate analysis of conditions or signs or symptoms that would lead to a bad outcome. And so you look at people at day 1, day 3, and day 7. And without going through the whole Levy protocol, and this isn't the Levy protocol we all know where you stop smoking for 3 days and then you start smoking again. That's a different Levy protocol. That's the Bob Levy protocol. But the most important criteria of this is if the patient is following commands on day 7. That's a very good indicator of excellent prognosis. There are a lot of indicators of bad prognosis.
Sure.
One of those being disconjugate gaze. In other words, that they're not able to, their eyes are just sort of floating around.
Can't focus.
The roving conjugate gaze on the first day, you may have a good outcome with those. And but this DeMar was following commands and signaling and actually communicating on day 5, I think, day 4 or 5, I'm not sure. Obviously, I wasn't there. I'm just going by what I'm reading. So those are all really good signs for good outcome. It says here, just 4 days after his stunning on-field cardiac arrest, Buffalo Bills safety DeMar Hamlin is breathing on his own and speaking to his family, physicians, and teammates. So, again, all signs of
he was 48 hours, couldn't talk, but was actually answering questions via writing and moving his hands and toes.
Yeah, well, he probably had to. He was probably endotracheal.
He was intubated. Yeah,
he was intubated, so he had a tube going from
on
the
ventilator.
outside to the inside of his lungs.
Yeah, I think they just took him off the ventilator on Friday.
I don't know.
Thursday,
I don't
Friday.
know. I wasn't there, so.
I saw it on the internet.
But anyway,
it's got to be right.
So, but that's how we look at these things. Is there are other there's blood tests that you can do. There's a serum neuron enolase, and you can do that, and it's a sign of bad outcome. If it's elevated, the problem with it is in our hospital, it takes 2 weeks to get back. So by then you already know. So what you're really looking at are clinical things like this. So the Levy scale is one. You could just look at the patient, do a very simple physical exam, and you get a pretty good idea of what their outcome is going to be. So they would have done that, and that's good news. So good for him. I'm glad. And what I'm concerned about is the way that the NFL does things. They ignore some stuff and then they knee-jerk other things. And I'm afraid that they're going to, now require some sort of sternal protection or something like that for something that happens one time in 60 years.
Yeah.
But it is 100 people. Would you say 100, 150 days, something like that?
Yeah, I believe
every
so.
year. I mean, we got a population of 350 million. The odds that that's going to happen to you are small, but still that's 100 tragedies. People just going out to play a sport and have some